According to a new Gallup poll, a record 60% of Americans say the situation is improving, which of course it is, but that doesn't mean Dr. Doom is having any of that.
We have circulating variants in the community. Some of them have increased capacity to transmit, and some are less protected by the vaccines. You want a plan that you will be able, within a reasonable time, to pull back, but not at a time when we have circulating variants.
There he goes again. And of course, the study he's relying on to claim that these variants can thwart vaccines is far from rock solid. For starters, it's a preprint, which means it's not peer-reviewed. And when you actually read it, it's clear there's nothing to be worried about at all. Out of the 2,000 people tracked in the study, 0 died from the terrifying new strains. So obviously, the current vaccine and the naturally acquired immunity that we all get if we're exposed to various coronaviruses does offer protection, some protection about what we're supposed to be worried about in the first place. Remember, we were supposed to be worried about overwhelming the hospitals, not vanquishing every trace of virus on the face of the planet. But the goalposts keep shifting. Joining me now is Dr. Paul Elias Alexander, former HHS COVID advisor. Dr. Alexander, how much longer can they keep up this fear-mongering over the variants? The science does not seem to be on their side.
Hi, Laura. Thanks for having me. I agree with you. The science is not on their side. And what we are seeing, we don't have the data. We don't have any evidence to show that the variants are more pathogenic. I mean, we know that when the virus mutates, it likely becomes more infectious. And that's what we're dealing with right now. And people like Dr. Fauci, and they sometimes, in all respects, the statements are almost absurd as they move these goalposts. Look, public health is not just about controlling infections and infection control. It's about chronic health also. We're going to have a lot of excess mortality in the years to come because of these lockdowns. And for reasons that escape me, really, Dr. Fauci and CDC, they're squandering a tremendous opportunity because they're doing a disservice to the American people. We have this report that came out yesterday about obesity being such a major risk factor. COVID exploits risk factors, and COVID has exploited obesity in the American population, particularly among the minority populations. And that's where President Trump's economic zones were so successful.
Dr. Alexander, what's really frustrating, and I'm not a medical expert, but I happen to have the great privilege and a great blessing of knowing really smart people who are not, going to be waving their hands around if something's not important. We were interviewing Dr. Stephen Smith, I think it was in March of last year, and this was at the very beginning of the pandemic. He was treating all of these COVID patients, and he kept talking about metabolic syndrome and the problem with people with high BMI, body mass index. That is such a huge problem. It was in Italy early on. It was one of the main comorbidities, along with hypertension, pre-hypertension, diabetes, so forth. So he said, I think at the time, America needs to go on a diet. That's one of the things we can do. And you never hear Fauci talk about that or D3 or ivermectin because they haven't even given emergency use authorization for ivermectin. Haven't even put out anything about that. They're way behind all these other countries.
Definitely. And we have a lot of good science now on this early treatment you just mentioned for elderly high-risk people. But back to that point, the issue is that the metabolic syndrome, excess weight in the stomach area, high blood pressure, high sugar, etc., we know this is a serious risk factor, especially for the minority population. And I think that CDC and people like Dr. Fauci should use the podium to come to the people and have this very serious, important conversation. It will dramatically reduce your risk. And your medicine cabinet, I've been looking at your medicine cabinet, have dealt with this for over a year. This is not new to them. This data has always been there. They have actually squandered and failed this opportunity.
No, and now we find out, according to a new Japanese study, that the idea of double masking, which of course we were ridiculing from day one, double masking essentially has no effect. Okay, a new supercomputer analysis in Japan found that there's like really little help in preventing the viral spread. And you're not surprised by this because you've been questioning this idea that mask or not mask, you're going to have much of a difference in a community. And they don't have that data, do they?
I know, and right now we've looked at all of the data and we've seen that the mask mandates are very ineffective. More importantly, the masks as they use, the blue surgical mask, the cloth mask, are not effective as standalone. They must be used within a compendium of other mitigation steps. So the double masking, again, that was a study done with some dummy models.
Dummies, not people. Yeah,
correct.
Dr. Alexander, we got to go, but the study was done on dummies, and
yes,
some dummies are now telling us to wear double masking. I'll leave it there. Dr. Alexander, have a great weekend. Great to see you.